Do you ever wonder if your child's rash is one that you need to worry about? I'm Dr. Mona Amin, a board-certified pediatrician and mom, and we're discussing two viral exanthems, measles and varicella, what the rashes look like in these diseases and treatment. In case you missed it, watch part 1 of this viral rash series to understand more about viral rashes and two popular rashes, 5th and 6th disease. Stay tuned for when to take your child to the doctor with these rashes, measles and varicella. Let's get to it. Thankfully, due to vaccination, measles and chickenpox are far more unlikely than when we were kids, but due to international travel and unvaccinated children, we have seen surges of these viruses, and thus I thought it was important to go over. Just as we did in my first viral rash video, we are going to use visuals to determine what the cause of the rash is. I'm going to put up pictures of rashes, and you have to pick which one you think goes with each viral illness. First off in this video is measles. Which of the following pictures do you think looks like measles? The answer is C. Measles is a highly contagious virus that causes a fever, cough, runny nose, red eyes, and a distinctive rash. The rash usually starts on the face and spreads down the body. It's important to know that measles can be serious, especially for young children, because it can lead to complications like pneumonia, ear infections, or in extremely rare cases, brain swelling, also known as encephalitis. Measles spreads easily through the air when an infected person coughs or sneezes. Generally, a child with measles is contagious from about 4 days before the rash appears until about 4 days after the rash starts. If your child is near someone with measles or touches something they've coughed on, they can catch the virus. The good news is that the measles vaccine, or MMR, is very effective at preventing the disease. The most common symptoms of measles are fever, which can be very high, and a triad of symptoms: cough, coryza, and conjunctivitis. Coryza is a runny nose, and conjunctivitis is a redness and/or discharge of the eyes. There's also a rash that starts on the face and spreads to the rest of the body, and also white spots inside of the mouth, which are known as Koplik spots. While measles usually goes away on its own as the body fights off the virus and most children recover after about 7 to 10 days, it's important to monitor them closely because it can lead to complications. We have a measles vaccine, given that measles can cause complications. These complications include ear infections and sometimes temporary or permanent hearing loss. 1 in 20 children can develop pneumonia, which prior to vaccination was the main reason for hospitalization or deaths related to measles. About 1 in 1,000 children with measles can develop encephalitis, an inflammation of the brain. This can lead to seizures, hearing loss, cognitive impairment, and in some cases, death. An extremely rare but long-term complication of measles is subacute sclerosing panencephalitis. This is a rare but fatal complication that can occur years after a person recovers from measles, affecting about 1 in 10,000 people who have had measles as children. SSPE causes progressive damage to the brain, eventually leading to severe neurological damage and death. Measles can be managed at home by resting and encouraging fluid intake, by managing discomfort with fever with acetaminophen or ibuprofen, and importantly, isolating your child at home to avoid spreading the virus to others, especially those who may not be vaccinated or fully vaccinated. The World Health Organization recommends vitamin A supplementation for children with measles, as it can reduce the risk of severe complications such as conjunctivitis and severe case blindness. Studies show that vitamin A supplementation can reduce the risk of complications from measles, such as pneumonia and diarrhea, and lower mortality rates, especially in malnourished children who are already at risk of vitamin A deficiency. Dosage varies by age and is usually directed by a clinician. Generally, your child can return to school when it has been at least 4 days since the rash appeared and they are feeling better, meaning their fever is gone, they are not on fever-reducing medications, and they have enough energy for school activities. Another common viral illness that has an associated viral exanthem is varicella or chickenpox. Which of the following pictures do you think looks like chickenpox? The answer is D. Varicella, more commonly known as chickenpox, is a contagious viral illness that affects many children. It is caused by the varicella zoster virus and can affect people of all ages, though it generally affects children the most. Chickenpox spreads easily from person to person through coughing, sneezing, or direct contact with the blisters. If your child hasn't had the chickenpox vaccine or hasn't had chickenpox before, they can catch it by being around someone who is infected. Chickenpox parties should stay in the 80s where they belong. This was so common back then to expose a child to get it over with since everyone got chickenpox. We know some children can get very sick, so intentionally exposing it is not a smart idea. And a not so fun fact, chickenpox isn't always a one-time gig. Once you get it, the virus hangs around and can come back years later as shingles, a painful, adult-only surprise party that's not the good kind. But here's the scoop. We now have a vaccine that's like the VIP pass to skip chickenpox and all the drama it brings. So let's skip the outdated pox parties and party in the 2020s where chickenpox doesn't get an invite, thanks to vaccination. The most common symptoms of chickenpox are a fever that usually starts a day or two before a rash appears. The rash starts out as small red flat spots on the face, chest, and back, and they then develop into fluid-filled blisters. The classic presentation is usually a rash like this that looks like a blister on a red base. We call it a dewdrop on a rose petal. These are intensely itchy. The vesicles eventually burst and a crust of scab forms over each spot. New spots may continue to appear for several days, which means that different stages of the rash, macules, papules, vesicles, and crusts can be seen simultaneously on different areas of the skin. The rash can appear on the face, scalp, and body, and even in the mouth. You may be wondering why, if chickenpox is generally a mild disease, do we bother giving the vaccine? While it is mild for most children, it can lead to serious complications, especially in infants, adults, and children with a weakened immune system. I still remember one of my pediatric cancer patients in residency dying from chickenpox that spread through his body. Vaccination is important for all individuals, but also to protect those who can't get the vaccine. Complications in healthy individuals can occur as well. These complications include bacterial skin infections, pneumonia, encephalitis, which is the swelling of the brain, meningitis, and infection of the blood or sepsis. The Varicella virus can also cause hearing loss as it impacts the nerves involved in hearing and the inner ear structures. Also, by getting the chickenpox vaccine, you can prevent the chance of shingles later in life. Shingles happens when the chickenpox virus wakes up again. After someone has a chickenpox infection, the virus doesn't leave the body. Instead, it stays asleep in the nerve cells. Years later, if the body's immune system weakens or gets stressed, the virus can wake up and travel along the nerves to the skin, causing a painful, blistery rash. It's like the chickenpox virus is taking a second trip throughout the body, but it comes out in a different way as shingles. As someone who has friends and relatives who were kids in the 80s who got chickenpox who are now suffering from shingles, this is not fun. Get the vaccine for your kids. Before the chickenpox vaccine was widely available, the virus caused over 10,000 hospitalizations and around 100 to 150 deaths each year in the United States. The introduction of the vaccine has drastically reduced these numbers, making severe complications from chickenpox much less common. Chickenpox is usually a mild disease, but it can be very uncomfortable for your child because it's so itchy. You can help your child feel more comfortable by making sure they get plenty of rest. To relieve the itch, you can use an anti-itch lotion like calamine or give oatmeal baths to soothe their skin. Keep their nails cut short to minimize breaking skin and having an infection due to scratching. Use acetaminophen or ibuprofen as directed for fever or pain relief, and make sure to keep them hydrated. As a reminder, avoid aspirin in kids. Your child can go back to school when all of their chickenpox blisters have scabbed over. This usually takes about 7 to 10 days. Until then, it's important to keep them at home to avoid spreading the virus to others because direct contact can also lead to spread. If you suspect your child has measles, talk to your clinician right away as it can lead to serious complications. If your child was exposed to measles, contact your doctor right away as well. Early intervention can reduce the illness's severity. Since measles is highly contagious, call ahead before visiting the doctor to arrange precautions and prevent spreading the virus. Contact a doctor if your child with chickenpox is under 12 months old, has a weakened immune system, a pre-existing condition like asthma, or hasn't been vaccinated. Seek immediate medical attention if your child has difficulty breathing, wheezing, and also watch for a rash that becomes red, swollen, or painful, which could mean an infection, which they can get from all that scratching that they do. If a fever lasts more than 4 days or your child has a severe headache or stiff neck, seek medical help right away. Also seek medical attention if you notice any signs of confusion, drowsiness, trouble walking, difficulty waking up, vomiting, or seizures. Have you ever been concerned about a rash in your child? What did the diagnosis end up being? If you found this video helpful, please give it a thumbs up sign, share it, and subscribe for more content tailored to help you understand your child's health, development, and behavior with confidence. Looking for more videos on various rashes, child health, or development? Comment below with any questions, comments, or personal experience, including those with viral rashes. I hope I brought some confidence into your parenting journey. Stay informed, stay empowered, and I'll see you all next time. Stay well.